Hello everyone, welcome to my channel. This is Dr. Melanie Tidman. Thank you for taking the time to view this video, which is one of several short research reviews. Please like, subscribe, and hit the notification bell so you don't miss any of my future videos. Please remember these presentations are for informational and educational purposes only. Please contact your own medical team before making any changes. My background is that I am a metabolic health practitioner, a professor, and the director of clinical research for the Colorado Parkinsons Foundation. Since 2018, I have been conducting clinical research in Parkinson's disease. Some of my former video presentations are located on my YouTube channel. These videos are a result of 7 years of research in Parkinson's disease. I invite you to review the full presentations or one of these short research videos. Today, I'll be briefly reviewing a research study entitled Effects of a Low-Carb, Healthy Fat Ketogenic Diet on Parkinson's Disease Symptoms, Depression, Anxiety, Quality of Life, and General Health, a pilot study. This study was conducted by myself and my research team, Dr. Dawn White and Dr. Tim White. In our study, we recruited a total of 16 participants. They participated in the intervention trial for 12 weeks. They were asked to consume a low-carb, healthy-fat, ketogenic diet. We explored any changes in their symptoms of Parkinson's disease, their depression or anxiety symptoms using common anxiety and depression scales that we use in Parkinson's disease. We explored these results in terms of their effects on health biomarkers such as weight, BMI, waist measurements after the 12-week study. We explored these effects on cardiovascular risk, and we also explored the effects of the diet on quality of life. We attempted to highlight any trends or the need for future research on the effects of this low-carb, healthy-fat, ketogenic approach on symptoms of Parkinson's disease, health, depression, and anxiety. We also had them participate in quality of life interviews conducted by my colleague, Dr. Dawn White. This was an observational pre-test, post-test, one-group epidemiological pilot study, and we were investigating the effects of a low-carb, healthy-fat ketogenic diet on the treatment of Parkinson's using the UPDRS, which is a common scale used by neurologists to test Parkinson's symptoms. We also tested some major biomarkers of health, including body weight, waist measurement, hemoglobin A1C, triglycerides, HDL, fasting insulin, and C-reactive protein. We also administered a depression scale and an anxiety scale. Our patients with Parkinson's that enrolled in this study were between the ages of 30 and 85. So we did a direct comparison of the same study participants' scores from baseline to 12 weeks. We compared their scores on the UPDRS scale for their Parkinson's symptoms, the CESDR depression scale, and at that time, the new Parkinson's anxiety scale. And then we compared their biomarkers from baseline and 12 weeks later. Our participants tracked their food intake using the MyFitnessPal app. If they did not have access to a smartphone, they did handwritten food logs and submitted them once weekly to the research team. They also used the Keto Mojo blood glucose and ketone meters and tested their blood glucose and ketones once a week at home. So the ketogenic approach we used is a common approach with a low carb approach, which included meat, fish, poultry, and eggs, very little or no dairy, and we kept the fats between 70 and 80% of their daily intake, proteins at 15 to 20%, and carbohydrates less than 5% or less than 10%. Mostly green vegetables or low glycemic vegetables, and then healthy fats, which included coconut oil, avocado oil, olive oil, grass-fed butter, beef tallow, and lard. And we encouraged our participants to drink a lot of water. The results of our 12-week study, briefly, we had an average of age 64 and a maximum age of age 80 for our participants. Our minimum age was 36. We had 11 men and 5 women participate in this study. This is a result of all 16 participants. This chart is quite busy, so I highlighted in yellow the results that achieved statistical significance. And as you can see, there were a lot of them. Briefly, there were significant improvements in BMI, fasting insulin, hemoglobin A1C, which is your marker of diabetes or your average blood glucose over the last 3 months. Their Parkinson's anxiety scale score significantly improved. Their UPDRS Part 1 scores, mentation, mood, and behavior, improved significantly. And their waist circumference and weight also improved significantly. Now, when we took those participants who maintained a level of nutritional ketosis, that is, their blood ketones remained above 0.05 for the entire 12 weeks, we found that 14 of the 16 participants were able to stay in this state of nutritional ketosis. These are the results for those patients in that group who achieved nutritional ketosis. And as you can see, marked in yellow on this chart, BMI, fasting insulin, hemoglobin A1C, the Parkinson's anxiety scale scores, their triglycerides, their UPDRS Part 1, their waist and weight, all improved significantly. So these improvements were compared with baseline. Our 16 participants lost a total of 243 pounds in 12 weeks, with a total lost inches around their waist of 52. Their BMI improved with statistical significance after 12 weeks. These are the results of just the UPDRS scores, which are related to their Parkinson's symptoms. As you can see, their mood, mentation, and behavior improved statistically significantly, with positive trends on their activities of daily living scores. My colleague, Dr. Dawn White, conducted post 12-week interviews to assess quality of life symptoms in our participants. These are indicating post 12-week impressions, and she did a thematic analysis on their interview transcripts. So the themes that she identified were improved mental clarity, improved mobility, they felt healthier at the end of 12 weeks, and they really had a lot of support from other family members during the 12 weeks. They also indicated that they felt they had improved their balance, that their movements were easier, they had some weight loss, and they felt like they were impressed with their improvements in their lab work. And some of them reported being able to reduce their medications. So this study aimed to evaluate a low-carb, healthy-fat ketogenic diet on biomarkers of chronic disease, the symptoms of Parkinson's, depression, and anxiety by comparing results of blood and body weight biomarkers and scores on some commonly used symptom scales. We assessed our participants at baseline and then at 12 weeks. The study consisted of 16 persons with Parkinson's, and they were required to consume a low-carb, healthy-fat ketogenic regimen for 12 weeks. Our intervention it also yielded significant improvements in 5 of the 8 biomarkers we tested, which were BMI, weight, waist measurement, triglycerides, hemoglobin A1C, fasting insulin, HDL, and C-reactive protein, which is an inflammatory marker. The results also showed some positive trends for overall Parkinson's symptoms. Further randomized controlled trials that are larger sample sizes definitely need to be addressed in terms of the effectiveness of this approach on symptoms of Parkinson's and biomarkers of health. So this is the publication that you can look up. I will link to it in the description below. So how would I, as a metabolic health practitioner, recommend that you use this information? Well, obviously, the low-carb, healthy-fat ketogenic approach with keeping your fat consumption up between 60 and 70%, your protein consumption between 20 and 25%, and your carbohydrate intake below 5% is an effective strategy according to our research. We also found that this dietary approach improves overall blood glucose control. It also improved inflammatory markers on blood work, and our participants reported they could move around easier, the mobility was a little better, and they could reduce some of their medications after 12 weeks. It was evident that all 16 of our participants lost weight. It also showed that anxiety symptoms decreased. We didn't have as big a result on our depression symptoms, but we felt like the study duration was probably too short at 12 weeks. So overall, I would recommend that the low-carb, healthy-fat ketogenic approach is a viable, feasible, and safe dietary approach for people with Parkinson's to help reduce symptoms, to improve their biomarkers of health, improve their blood glucose control, and their weight. Thank you for viewing this short research review. The full presentation on this study is linked in the description and presented on my YouTube channel. I'm also going to link to the study article publication so that you can review that study article yourself. Please check back on my YouTube channel or hit the notification bell and subscribe so that you'll be informed of my future videos. If you're interested in participating in my research in Parkinson's disease, I also linked an email address where you can email me directly with questions or if you're interested in future participation. Thanks again and take care, everyone.